Hello, everyone. We're back. Hello. Oh, hello, Kyle. I feel like we've had a bit of a hiccup last week, folks. If anyone did join us last week, we do apologize. It was on our end 100%. And I really missed you guys. It was really sad. Really excited for this webinar, folks. This is absolutely, I'm just excited. Like, there's so many cool things to come out of what's about to happen here today, and I cannot wait. But we will give it a minute or two. We are just waiting for one more guest. We're just making sure connections work correctly. All right. Carmen is in the chat, everyone. Carmen is in the chat. You're not sadly going to see her today, but do say hi, give her some love. Let us know where you're coming from, how you're doing today. I've seen Jersey. I've seen Toronto. I have seen, let's go to scroll down to CA. You guys will notice a couple of familiar name in the chat. Andy's with us again today. We're very excited. I'll go through, make sure everybody knows who's who. Don't fret. Hope everyone, it is sunny. It's not cold, but it's cool. It's sunny and cool and beautiful here in Toronto. If you've got some good weather, please make sure to get outside and enjoy the sun while it lasts. Because in January, when we're doing this, it will not be this beautiful. So welcome, everyone. Very excited for this. Welcome for this webinar. You guys if you're new to the webinar, you will know there's two things about me. A, I'm bad with saying names, and as our guests have actually learned that sadly quickly. And B, I can't type and speak at the same time. So this is the beauty of being able to multitask is not in my genes here. So minute or two more, and then we're going to go live because folks, it's packed. It's a packed schedule today. So hello, Kentucky. Stacy, a little freezing up your way too. Yeah, you just kind of you just do what you got to do, right? You just do what you got to do, folks. We're going over our 2020 benchmark. This is huge for us this year. I'm going to give one more minute here just because we did, just to make sure everybody gets in and out. And I know we got a couple of people returning have said hello. Welcome back, everybody. Welcome if this is your first time. If you have not heard of Hi Mama, where have you been? I don't know. Hello, Sandra from VA. It's rainy. I know I was heard the bad weather down there. I'm going to have to actually hop on the news later and just see what's going on because I just disconnected after everything with the election. I took too much media in and then needed to give myself a bit of a break. So some great people on today, folks. Super excited. Hello, Washington, D.C. Vancouver. Hello, Van City. I was out your way. Oh my goodness, July. It was a while back. Very excited. Let's get started. I don't want to keep anybody waiting. I don't want to keep our special guests waiting. And I also want to make sure that we have enough time for everybody. Just two things before we dive in to our disclaimer. We are purposely running over a bit of time this week. We're going to be doing about an hour 15 this week because we have a couple of extra guests on and we want to make sure to give everybody some appropriate time. So if you do have to duck, don't fret. We record everything. Okay. But before we do, disclaimer, just make sure, guys, tips and tricks come from all of this. But for you today, really just some high-level information coming from our benchmark today. So just remember, we're not your legal consultants. If you have ever been with me, you know I'm not your financial advisor. This is why I didn't go into finance. This is not my rodeo. 100%, just to make sure you guys are clear. We're good to go. Let's move on. It's all good. So like I mentioned, recorded session, always recorded. So it will be available. We'll get it out in the show notes for you tomorrow. So if you do have to duck before that hour 15, then it's all good. We'll make sure to get you all hooked up with everything. Certificates, A, will be available here at the end of the webinar, and B, they'll be available with the show notes as well. So you don't have to worry about if you do miss out on anything there. Last but not least, as we always know, because for some reason the connection issues just go up and down with this guy. Please refresh or just reconnect. You guys should be good. We should be good. What is going to happen today? As always, Carmen is my coworker here. She works here with me at Hi Mama. She's on the chat doing her fabulous job that she always does. So please do say hello to her. And if this is your first time, welcome. If you've never met me before, my name is Ria. I am one of the early childhood educators here at Hi Mama on the marketing team. And guys, this is my 29th webinar. I was looking for a fun fact and I couldn't find one. And then I found it. So this is our 29th webinar. This is wild. It's been a crazy year. What can you expect today? It's huge. So our 2020 benchmark was released this week. This is a huge, huge report in so many different ways, folks. It covers so many cool things. And what we've done is every year we do some, well, I shouldn't say every year, but this year specifically and last year, we partner up with a couple of key people and we have them all here with us today. And we go through a couple big pieces. So this year we're talking a little bit more about enrollment, staffing, finances. Of course, we're going to talk about COVID-19. And one of the pieces I'm actually really interested in right now is the future outlook of childcare. And we're going to go through each of these with our partners here today. So who are they? Don't worry as well. Q&A at the end. Don't forget, if you have a question, please shoot it on to Carmen. This way you can get a question answered as well. We only have so much time too, so make sure to get it in early, and we do our best to cover as much. So, okay, so we got Cindy Alexander coming from the Child Care Success Company. Guys, the names are rolling together for me, I won't lie. But she's coming in Chris Murray's stead here. I'm super excited to chat with her, though, and we have a little quote here from Chris, but she was one of our partners. We have Carla Rogg, president here at Pro Solutions. We're waiting on Cindy from NCCA. We're just making sure her connection gets up and going. But we have Andy back from the Institute of Childhood Preparedness. And we have Dr. Calvin Moore coming from the CDA Council. So amazing group to be chatting with here. This is going to be a blast. So let's dive in with a couple of key highlights. But before we do, we want to start here with a quick message from Ron. If you've never heard of Hi Mama, Ron is our CEO, our co-founder with Alana. And this was the quote he actually gave us here for the benchmark. You'll see it in there. If you do as well want to go ahead and download it, it's in the blue little sticky note across the top. Please download it. It's fantastic. You won't find this anywhere else, folks, okay? So childcare businesses, we all have small profit margins at best at times, and especially those small businesses. And they've been challenged to continue to operate with altered ratios and additional procedures in place. Ron is very on top of what is happening in the education space. We know this is no news. This is news to nobody, but let's dive in to our key highlights from this year. Okay, so we're going to go, there's 5 specifically. I want to talk a little bit here quickly about, revenue, net income, labor costs, kind of what happened over the course of this year. So we definitely saw revenue decreased by 64% in 2020. Not a surprise, COVID has been happening. And because of that, we've seen a net income drop as well. But it only dropped by 17%, which I actually, I was a little shocked about here, folks. It was a little surprised. But the margins are so tight, it showed us that business owners are actually doing their best to manage that cash flow, especially in really hard times. And, we're going through those hard times and still. So a little bit about occupancy rates. So, of course, the pandemic is here among us, but we've had a lot of parents who try to they're keeping their children home. They're trying to keep them safe right now, and I totally respect that. But because of that, we've seen a huge increase in empty spaces right now in childcare centers. So this is between 2019 from our last benchmark study to this year's, the 2020, we saw a 241% increase in empty childcare spaces. So folks, what happened? We know what happened. COVID happened. Remote learning. I thought this one was very, very interesting. We all know it's very popular. We've done several webinars around remote learning and about, providing that distance learning in the classroom. So from our participants, we saw about 39% have been exploring remote learning. And then the really cool fact that I saw was 38% had planned to keep on their remote learning and offering it up to families. So I think that this is absolutely amazing. And I think you guys should definitely take a look at the benchmark to get some more insight about this. Risks overview. This one was also a very interesting piece. So of course, over the last, we've been tracking over the last couple of years. This is our 5th benchmark. And this year, of course, we saw one of the big things was, as when it comes to risks, financial has taken the #1 spot, of course, because, everyone, and by all means, should be curious and should be looking into their finances about what's going on and what they have for the future. And that's obvious. And labor dropped from #1 to #2. But the one that took me back a little bit here was actually this one. So the most, like the priorities, we asked them to rank their priorities when we do the survey and to what's most important, what's least important. And one of the big things I saw was customer satisfaction held strong at #1. And I thought, and this is for the idea of going into 2021. And I'm like, wow. The scary one, for me, scary, I shouldn't say, you don't have to be afraid. The scary one was employee engagement dropped to #4. And I think that is where, when it comes down to a couple of key things during COVID, that we should be keeping our eyes on things like these. So it was really, really interesting to see. Let's talk about enrollment. This is where I want to spend most of my time, is with our special guests. So I'm super excited. Like I'd mentioned, so we have partnered with Chris Murray from the Childcare Success Company, and we actually have Cindy joining us on her behalf today, but she left us with a beautiful quote. So remaining consistent with your marketing and your enrollment building efforts will be the key to continuing to enroll more students. Focus on consistently reiterating how clean and safe and ready you are to serve your community, and make sure it's easy for your school to be found online. And I want to welcome Cindy here with us from the Childcare Success Company. Come on, my dear. And so she's Director of Marketing over there. Been in childcare for over 23 years. Absolutely fantastic background when I read your bio. Before we dive in, please tell us a little bit more about you and what's happening over there at CCSC.
Well, awesome. Thank you. I'm so glad to be here. I know that we partnered with Hi Mama for a couple of years in a row. Now, I don't know if this is our 2nd year or our 3rd year partnering on this benchmark report, but it's an amazing report, and it gives great insight, into the state of the industry. So I'm so happy and so honored to be here representing Chris Murray and the Childcare Success Company. Our mission, our goal is just to empower childcare business owners to be able to live their best lives by the services and the coaching and the consulting that we provide. Our goal is to positively impact at 1 million children through helping childcare businesses to improve their financials and thus their quality. It all trickles down. So we are tracking that, and we're about halfway there, a little over halfway. And yeah, that's our goal. That's our mission. And I am 100% psyched and on board with that, along with Chris and the rest of the team.
Your whole team is doing some amazing things. I just love what your company stands for, how you guys work with other childcare businesses, like just everything about it. Let's dive in. Of course, enrollment is hot topic right now. It's been a huge challenge for the sector. We saw a 33% on average, drop because of COVID. How have you guys at Childcare Success Company been helping adapt and support businesses and business owners, and how have you guys helped them tackle this challenge?
Sure. So it was really, really interesting in the beginning of this, back in March and April and May, when everybody was scrambling and trying to figure out, am I open? Am I closed? What's PPP? And what are these other SBA loans? And, what do I do with my business? And so for our members, we have a membership called the Childcare Success Academy. So we were doing weekly and sometimes twice a week extra Q&A calls where we were diving deep into all of those issues and helping get people the info that they need. And our members were also sharing files with each other, like, this is what I'm doing. Here's an idea for you, And so all of that tribe and that community and the collaboration and the extra calls we were doing for our members really, really help them out. But as far as public facing, maybe somebody who's not in our membership, I mean, we did some podcast episodes. We put together the ultimate, COVID survival toolkit with lots of the templates and things that were provided by our members, so we could share. We did a couple of extra webinars helping people. So we were just trying to just get out in front and be a resource for childcare business owners that were really, really struggling or just didn't know what to do, didn't have the answers, and help to clarify, some of those things that were resources to them, or some policies that they could change, or ideas that established businesses were doing that were working.
It's a lot, but I'm so happy to hear that you guys were doing so many things, because, people, especially when it all went down, like you said, they didn't know where to find things, like find PPE. They didn't know, there was no real, there's no book for this, and we don't have to create the book on this, but there's obviously been lots of challenges. So I love that. I love how you guys just stepped up and just let's do this. What were the key areas, though, that you guys, especially marketing messages, maybe that centers should use or focus on in order to help parents, and when they're trying to keep their enrollment up? We thought that this was a big steady piece, but maybe what some of the marketing messages you guys have put out there to help with the enrollment and help centers work through the pandemic?
So even before marketing message, you really, really need to make sure that you can be found online. So that is key. Your website needs to be updated. It needs to, be optimized for SEO, so that people can find you. So that's number one. You need to be clear on not only your traditional USPs, which are unique selling points, unique selling propositions, the things that make you stand out, make you unique, make you different from your competition. Not only those, but you need to add in USPs that focus on the health and safety and changes that you have made to, combat's the next word, but to proactively keep children and families and staff safe as best as you can. I mean, with all of the protocols that we can put in place, it's not 100% guarantee ever, but you need to show that you are stepping it up, that you have this in mind. And I mean, it could be anything from, at the door drop off, temperature checks, exclusion policies. You get a Zono machine, you get those electrostatic sprayers, anything that you are doing to help children, families and staff be safer. You need to be over communicating that, and maybe even add some videos, maybe add social stories, just communicate that everywhere. And focus on delivering value. You might need to think outside the box a little bit. What are, maybe survey your parents, ask them what their fears are, or what their needs are. I mean, you might be surprised at what they find, or what you find out. But, if you can focus on delivering value to the parents, and it could be old values, new values, just communicate those. However you can support families, I think that is key.
I totally agree. It's value and how they're keeping staff, families, children, you name it, whoever's at the center safe, and conveying that outside, online, wherever they need to get it out is definitely huge. Let's jump back, a bit of a business perspective. So what are your thoughts on centers offering a mix of in-person and the online programs to support families right now?
So it's actually one of the approaches that we were teaching early on, and you need to adjust. Yep. You need, outside the box. If you're not changing, you're not growing, right? And so our world changed back toward the end of March, and so we needed to change how we were running our business. Now, in the early days, there was a lot of schools that were just completely closed, either mandated or they chose to do it for safety purposes. And in those instances, we really, really believed that it was almost essential to add value and stay connected with your families by offering some sort of online or virtual preschool. And whether or not that was your teachers are reading a story and you're posting it on your Facebook page, or you've created a curriculum, the parents sign up and you charge them an X amount per week in order to participate in that. However that looked, it was essential just to stay connected so you could be in front of those families and get them back when you were ready to reopen. That being said, these virtual preschool programs, it's not like a high school virtual preschool.
No.
Parents or a caregiver need to be involved to help the child to be able to either, watch or participate. And so it's not truly a replacement of what happens in a child care preschool setting.
Yep.
So at this point, with a lot of schools being open, some of our clients have scaled that back a little bit. It's not as important, but it's still a value add. Even if your school is open, to continue with those teacher story times or craft lessons, we're in support of it. But I don't think it's as essential if you're open.
Got
Does that make sense?
Yeah, no.
It's certainly a value add.
Yeah.
So I would not discourage anybody from doing it. I think that virtual and Zoom, though these types of things are just like when webcams came into daycares and preschools. At first, it was a new novel thing, and now it's almost expected everywhere you go that the center has some sort of visibility, whether it's visible to the parents or just behind the scenes to the directors. It's almost to the health and safety procedures or equipment that are in your school, whether it's the fogger.
Sydney, I want to make sure that we have enough time for everybody before we move on here to our next guest. Is there any words of encouragement or advice you want to leave us with, especially looking to 2021, as it's not far around the corner?
Well, I think that enrollment, parents will always need childcare. And if we're allowed to operate and we operate as safely as possible, just keep finding ways to think outside the box and add value to your clients, build relationships and aim to increase that retention rate, and maybe focus on referrals. If you have families that are happy in your school, and they see firsthand what you're doing, those are going to be the most powerful messages, like enrollments. If Susie hears from Karen, who's attending your school, and Susie learns that Karen's happy with all you're doing and the way that you're handling COVID, she's more likely to enroll with you. So just continue to connect and see how you can gain those enrollments. If you'd like to find out how we can help you, it's childcaresuccess.com. Just click over there. But otherwise, be found online, build relationships, get referrals, and it should add value.
I totally agree. We're also as well going to include your website in the show notes so everyone has a quick access to it. But from everyone here at Hi Mama, we want to thank Chris for obviously saying yes and let's partner. But for you, for being here today on behalf of us, thank you for being a part of the benchmark as well. Stay with us, of course. We're going to bump you out and we're going to go on to Miss Carla here. I believe she's next to talk about staffing, folks. All right. Great quote from you here. I loved this. Great onboarding. And I love the word onboarding because I feel like it gets underestimated and underused when staff are starting at a center. But it helps keep staff more engaged, happier, when professionals feel connected to their employers, of course, and committed to their careers. Their interactions with other people are more positive and constructive. 100%. Carla from Pro Solutions, I always want to say something else and I don't know why, but thank you for joining us. 25 years in supporting childcare leaders. I was reading your bio, I was reading a little bit more on your website. Everything about what you guys doing at Pro Solutions as well seems just like so on point, especially right now during COVID. But tell us more about you and of course, what Pro Solutions is up to right now.
Well, thank you very much. Thanks for that great introduction. As you said, I'm with Pro Solutions Training, and it's actually the training division of our family company, Care Solutions, which is a product technology company. And people often ask how I got involved in all of this because I founded the company. It's actually been 30 years. I must need to update my CV from the 25 years when I had that one there. But I originally went to school for social work. And while I didn't stay in the field, I quickly realized that I had a true passion for working with children and families and teachers and helping them give children kind of their best start to early care and education. And along with the technology that we provide, we started professional development, and it has just evolved over the years from all that on-site training that we've done. And about 10 or 11 years ago, we took everything online, and we now have a library of over 250 courses, including the CDA, which we're very proud of. But you know, the one thing that hasn't changed in all of the years that we've been doing it, our training, is the point or the purpose, which is really, it's not just for the state mandated hours. Now, granted, everybody likes to get credit for what they're doing, and I get that. But you know what? Our training is really built to help that teacher be better in the classroom. And when they're better in the classroom, then our kids are going to be better. And that's what we're all about, is providing and inspiring that potential. And that's really my passion. And I have the best staff ever, and it's their passion too. So thanks for having us here.
I love this. I love, especially when you want to, changing that and putting it empowering on the teacher side just makes me so happy being a teacher and hearing that coming. I'm so happy hearing it. Okay, let's dive in, because I want to make sure to give you the top percentage here. So the pandemic, of course, and staffing with educators right now it's gone down 68% according to the benchmark for us this year. Of course, that's being our survey responding. But, you know, they're not at ideal levels. And so what's your advice around recruiting during this time? We know that, of course, recruiting techniques have probably changed. What's your thoughts on this?
Well, you know, it was staffing and recruitment were tough before the pandemic, and now it is even tougher. And I wish I could tell you that there was some magic answer, but there is really no magic bullet to staffing and recruitment. There just isn't. I mean, it is just an ongoing administrative responsibility, but you have to be very intentional. And I think that is the key. It's ongoing, and it doesn't stop when you just hire someone. But kind of going back a little bit to the hiring, you know, some of the strategies, I mean, you have to keep that pipeline going. And that includes networking. And that networking can be with some of your local colleges that are providing the different early care and education programs. A lot of it can be around social media and the online forums that are there. Staying connected to some of the Facebook groups that are in your local communities. We get some of our best learning from some of the closed Facebooks, groups that we are in. You know, I'll pass on one center who has really been very successful. They really struggled with recruiting for a really long time. And I mean, obviously they still have some issues. I mean, like I said, the pandemic has been tough on everybody, but they have started an open interviewing every Thursday from 4 to 6. And that time frame is so that people can come after work if they want to. And so people know that if they want to interview, they don't have to have an appointment. It is open interviewing every Thursday from 4 to 6. It's, you know, they keep safe. It's on site. And so over time, the community and childcare providers have learned that this particular center, if you're looking for a job in childcare, you can, you know, this is a place that you can go. So I thought that was really kind of pretty unique of a way of doing it. But again, there's really no one way. But I want to piggyback something that was just said in the previous presentation. I think you have to let your potential teachers and staff know that you are taking all the precautions necessary for health and safety, because that's, you know, we lost a lot of people staff that may or may not have come back because they've been very nervous and worried about their own health.
Of course.
And so I think it's really important to let not just your parents know, but your potential teachers and your staff know what you're doing to keep things really safe. So
I think that's huge. It kind of echoes what Cindy was saying before about keeping that communication, that value, and keeping it there. It applies not just to families, but it definitely applies to teachers as well. It's a huge piece, especially for an employer who's trying to keep everybody safe and run a business at the same time. It's a struggle. It's you know, you got to balance both ends. So any tips on leaders retaining like a key member that they value if, you know, obviously right now COVID's huge and we're all worried about health, but is there anything leaders can think about or potentially put into play to keep those key members of their staff there without losing the value in their centers?
Well, no, that's great. And I think that building rapport with your teachers is really important. And it's not a lot different than your teachers getting rapport with the students in their classroom. It's about engagement and making sure that you have that. It's about communication, and communication is really, really key. You need to be transparent in your communication. You need to let your staff know what your expectations are. And I think also we forget so many times that communication also includes listening. And so I think it's really important. Communication is, like I said, it's expectations, it's transparency, it's listening. And then I also think it's feedback, especially for your new staff. They need to know what they're doing right, and they need to know what they're doing wrong. And those messages need to be delivered very professionally and very timely. And then the other thing is I think sometimes we get so excited to have that person in our classroom that we're like, okay, move on. Let me move. There's so many fires going on every day.
Yes.
To figure that, that person in the classroom, now we've got that set. But that's not true. We've really got to keep that relationship going, and you've got to stop by that classroom. You need to cultivate and make sure that that they know that you are there for them. So I think it's really key. But again, it's engagement, it's communication, it's feedback, and it's presence.
Totally. It's part of, building that communication with parents and in building value with parents. You have to basically take it and reapply it for not just the children, but for your staff as well, because it's just as important to have that open connection with them as you do with your families as well. So
That's right.
Carla, I want to make sure that we have time for everybody, of course, and we're going to bring you back on. But any words of encouragement, advice for anybody today that you want to give out?
Just one: patience.
Oh.
I
love it.
There, patience. Every day, if we've learned nothing else during this pandemic, we have learned how to pivot on a moment's notice. And so, I just encourage everybody to remain vigilant and to remain patient. So, those are my words. Or my word.
Your word. I love it, and very true. Even for myself, I've had to learn more patience than I think I ever did know before. So, Carla, thank you. Thank you to you. Thank you from everyone at Pro Solutions for, being a part of the benchmark this year. It was super valuable to have you guys join us as well as partners alongside CCSE and, everything you guys are doing as well to make an impact on the education space. So thank you. Don't be shy now. And we'll bring you back for Q&A, but I'm going to kick you off.
All right. Thank you.
She'll be back, folks. So we sadly have not been able to bring in Sydney. Sid, guys, I can't speak today. It's just happening. We had this lovely lady not be able to show up here today, but we wanted to make sure that we at least have her quote. So this is super huge as well. All about finances here from Sydney. So business leaders and parents that depend on affordable, high quality childcare, which is huge, guys. It's huge. We need to actively and consistently pursue the support of their individual U.S. Senator in the passage of the Child Care Essential Act. I think, at the end of the day, like I'd mentioned, financials were the number one risk, and we had a couple of key questions. We're going to make sure to have her back on another time here, but let's jump forward here to the one and only Andy. Folks, you've seen him here before with us. This is a gentleman who does not need any introduction, but your quote was amazing, so I have to read it out as well. Early childhood professionals rose to the challenge during coronavirus 100%. Absolutely 100%. Faced the Herculean tasks, and in many cases, a lack of support and guidance was there. They sacrificed enormously to help keep the children they serve in their communities safe. Andy, welcome back.
Thank you. It's good to be here. Hey, everybody.
No stranger. I feel like you a couple of weeks back. If anyone's never seen Andy on a webinar, we think this is the third. We've lost count. Andy, for those people who potentially are new, maybe just give us a highlight of what the Institute for Childhood Preparedness is up to, and a bit about yourself, of course.
Sure. Well, lovely to be here with everybody. I'm with the Institute for Childhood Preparedness. We work every day to make sure that child care professionals know how to prepare for, respond to, and recover from emergencies and disasters. So all things preparedness, whether it's fire, floods, tornadoes, earthquakes, active shooter events, pandemics, we cover the whole gamut, and we just want to make sure everybody is as safe and as prepared as possible.
I love it. I love everything about it. You have a new book. It's coming out. It's not coming out. It's coming out soon.
Right. Yeah.
Yeah.
So a 3-book series. Book number 1, Preschool Preparedness for an Active Shooter, is out. And actually just yesterday it won Book of the Year award. So very exciting about that.
Wow. Congrats.
Thank you. Yeah, it's a big honor. Book number 2 is available for pre-sale right now. And that talks about planning for emergencies and disasters.
Yep.
And I am writing the 3rd book right now, which will be about disaster recovery, what to do after an emergency or disaster. So all those are available. We'd love to have you pick up a copy of them.
Excellent, excellent. We'll make sure, like all of our partners here today, we're including links. So don't fret, guys. We'll make sure to get some links out. But let's dive in. Partnered with us, we're talking about COVID-19, which is a very hot topic we usually have you talking about. It's been a huge challenge. We know this over the last year. It's been huge. But one of the big findings that the community from this, that the community's risen into the challenge, and you're in your work now. What have been some of the key actions that have led to providers maybe being successful and managing the challenge of the pandemic so far?
Yeah, and I wish that, the predictions that we made several times on this venue wouldn't have come true. But unfortunately, Rhea, this is kind of what we thought about. When the fall came back and the flu season, we had anticipated seeing this dramatic rise in cases. And we're looking now at 52 million cases across the world, 1.2 million deaths across the world. And of course, Canada is no stranger. We're seeing a new record yesterday in Ontario with daily cases, a new record in Manitoba with daily deaths. We're seeing Quebec at about 1,100 cases a day. And as you know, Alberta's, thinking about putting some new restrictions in place. So not only here in the United States where I'm at, 10.4 million cases and 240,000 deaths right now in the United States. So that's about a 69% increase in cases that we've seen over the last 2 weeks. So this is definitely on the wrong trend. It's on the upward trend.
Yep.
And, like we've said several times before, we encourage you to prepare for the long haul. To answer your question directly, there's really 4 things that I think are really important for programs as we continue to face the pandemic. The first one is training and education. And we have talked about this before, but we have a whole suite of online programs to help you get through the coronavirus. How do you clean and disinfect? What about food safety? What about mental health? What about domestic violence? A new one we just put out a couple of weeks ago is crisis communications. And I echo the stuff that Carla and Cindy talked about earlier.
Yeah.
Communication is so vital here. So making sure you get that training and education for your staff, which then also gets, back to staff satisfaction and staff retention, very important. Making sure that you have empathy and recognize the emotional and mental toll this is taking on folks, as this is a prolonged incident, very important. And again, as a previous speaker mentioned, we're not meant to be in this fight and flight forever. This is, you think about most emergencies or disasters, and here on the East Coast of the United States. So that's really important to recognize the mental health this is taking on yourself, on your parents, on your staff, on the kiddos. One of the big findings from the report, about 70% of folks have said that child development need to be going forward. And then finally, the last thing, please, you got to be creative. You got to be flexible in these times. The programs that are doing the best right now and have done the best throughout this pandemic have been the ones that are just so creative and willing to take chances and take some risks. I just did a podcast with a huge hospital system, Texas Children's Hospital in Texas. They've got multiple locations, about 30 different locations.
Oh, wow.
And one of the things we talked about is we can get stuff done now that we've been trying to do for years, right? So an example is a drive-through immunization clinic, or a furtherance of a electronic medical record, or instituting technology to do, remote consults if you're a doctor's office. So, people are using COVID to really break down barriers and make decisions and drive change in really a really quick turnaround, and stuff that we've been thinking about for years. We finally now have that opportunity to dive in with both feet and do it and see what works. And I think we've seen that in the benchmark report too, with so many folks that are, trying out the online learning environment and trying to get creative. So, don't get locked into it's business as always, because it's not. These are unprecedented times, and they call for some unprecedented solutions. So be creative out there. I think that's a really good thing that we can do.
And if anything, I think we've learned, Andy, that educators are definitely creative and we're resilient. We do bounce back, and we tend to come back bigger and better than ever. What's your concerns right now about the health and safety kind of aspect of, like, is there a light at the end of the tunnel? What will the long-term impact of the pandemic look like, you think, on childcare right now?
Well, I think there's some good news, right? So we've, so normally in a normal process, it would take about 18 months to create a vaccine. And we've been talking about how the vaccines are coming and coming and coming. Got some really good news from Pfizer and some other companies too. So there is some good news. Now, I will say, we always want to be real. This isn't going to be something that's going to happen overnight. There's a lot of challenges right now with the leading vaccines that are out there. First off, you're going to have to get at least 2 shots. Yeah. And they're going to have to be 21 to 28 days apart. So it's going to be logistically a little confusing. But the big thing that we're facing right now is that the vaccines that are being developed have to be stored at -60 to -80 degrees Celsius. So that's probably colder than Alberta. I don't know. But
it probably is, actually. I don't know.
So that's really cold. And, quite honestly, pharmacies, hospitals, doctors' offices, they don't have that kind of deep cold storage capacity. So that's going to be very limiting. And, the once you actually take that vaccine out, it's really only viable for about 24 hours. So, the first stage here is going to be, where can we get a lot of this vaccine out in a very short period of time? Because I can't keep opening the box and closing the box, because this is really temperature sensitive. Mm-hmm. So we're going to be looking at big places, and this is where your priorities and your ethical discussions and all that come in. But I would expect to see the first batch be hospital workers, nursing homes, first responders, people like that, where you could go to a site and, give a vaccine to 1,000 people in a day. That's kind of what's going to happen. Now, for us in the general public, we're probably not going to get to see a vaccine till probably April or May. At the earliest. So it's going to be a while. I mean, there is some light here. The good news is all the stuff we're doing to prevent coronavirus also really helps with the normal flu season. And the normal flu season is really way down, which is really good news. So keep washing your hands, keep staying apart. Obviously, air travel isn't happening, so we're not getting a lot of viruses spread around the world like we normally do, and cruise ships and things like that. So that's a good piece of news, but we are going to be stuck in this for, the foreseeable future and until at least the spring or summer at the earliest.
I agree. I think we knew we were in it to the long haul. By this point, it was inevitable. We knew that, but there is some light. It's just slowly coming, I feel like. Andy, I always enjoy having you on, and we were joking around before the session, folks, that Andy and I could probably go on for ages and ages. But any advice on providers moving forward into the winter season, or any words of encouragement you want to leave the folks with today?
Yeah, I mean, you guys have done a fantastic job. Keep doing what you're doing. We know that this virus spreads really easily when we get inside. In fact, about 80% of the infections of the virus can be traced to, grocery stores or large venues where you go inside, restaurants, concert halls, these types of things. Mm-hmm. So we want to avoid that as much as we can. So when you do have that opportunity to move things outside, when you do have that opportunity to open up your windows and get some fresh air, that's something really, really simple we can do to get rid of this virus. It's really, really easy to get rid of it just with a little bit of a airflow in your building. So just opening those windows can be helpful. And again, doing as much stuff outside as we can is helpful too. And let's just hope the winter isn't all that bad and we can get outside a little bit, right?
I agree 100%. Andy, thank you, for joining us again today and being a part of, from everyone here at Hi Mama, for being a part of the benchmark this year. It's been a pleasure as always. Like, this is not the end for us, and as well, your team at the Institute for Childhood Preparedness. Thank you guys for all you do and helping centers be the most prepared they can, or working on a prepared plan for whatever it is their area they need to maybe be working towards, and making sure our children and our future are safe. So thank you for that, and thank you for being here.
Absolutely. Thank you.
Kick you off and bring you back in a little bit here, and we're going to bring in Dr. Calvin Moore, folks. I'm so excited to be talking. This is like my topic right now that I keep reading and reading and reading about, and of course, there's no answer, but I want to read this fabulous quote that you left with us in our benchmark because it really resonated with me. So, early educators have been called upon during this unprecedented time to fill a critical need in order to help parents return to work. As more people recognize the essential role early education centers, and educators play, we should support greater investment in this sector. I am behind that 150% in so many ways, shape, and form. Calvin, thank you for joining me today. It's such a pleasure.
Yes, thank you for having me.
So
I've been looking forward to this all week, by the way.
Oh, good. I'm so glad. Let's start with, of course, I want to know, I don't really know you too well. So a little bit about you and a little bit about, the CDA and what they're up to, because of course people want to know.
Well, I am new to the Council for Professional Recognition. I've been CEO since May of this year, right in the middle of the pandemic.
Oh, wow.
But I have been in the sector for 30 years. I started working in early care and education in 1991 as a Head Start teacher aide. So I really cut my teeth. I bleed Head Start. But I've done other things in the sector as well. I've worked in the federal government. I've worked at the state level. Of course, Head Start is a community-based program. So I really am well-rounded in terms of what I bring to the table at the council. In fact, I earned my first CDA in 1992. So I'm the first CEO at the council to have actually gone through the credentialing process, and I'm very proud of that.
That's amazing. And it's just full circle for you too, right?
Absolutely.
That is amazing.
I feel like I've come home because I've been a champion for the CDA for almost 30 years now.
That is wonderful. Okay, let's dive in. Tell us a little bit more about how the professional development at CDA has adapted to, of course, support providers during this crisis right now.
Well, the council's mission is to promote and improve performance and recognition of professionals in the early care and education of children birth to age 5. And we have a wide network of training professionals across the country and indeed the world who are training CDA candidates. You had one of our fabulous training organizations, Pro Solutions, on earlier with Carla. She's a wonderful example of how the professional development of candidates has continued to move forward, even in the midst of this pandemic. And I think training institutions and institutions of higher education have done a wonderful job moving quickly to a virtual platform to make sure that candidates are continuing to grow and learn and progress as they earn their CDA. At the Council for Professional Recognition itself, we have constituted a national CDA advisory committee. And so we have CDA holders from across the country who have come to the council to share their wisdom as CDA candidates and early childhood professionals think about how they can reopen and begin to serve families during this global pandemic. So we're proud of that as well.
Wonderful. I love it. Okay, let's go a little further. The top priorities, let's say the top 3 priorities for childcare centers this year are, of course, we found this out in our benchmark, customer satisfaction, offering quality programming and increasing enrollment, which is not a surprise to us, especially right now. But what's your advice for providers who may want to make sure they're moving the dial on these priorities, given the challenges that they've been having right now?
I'm not surprised that customer satisfaction is at the top of your list. I know when I was working in local programs, we really depended on customer service because we believed that it was not a department, but that the customer service aspect was essential to the full company. And it's everybody's business. And how a customer feels about the quality services that you're providing really matters in the long run. And it's why people come back. I remember when my children were young, I looked for other folks, as Cindy was saying earlier, who could give me a real good sense of the quality that a provider was providing their clients. And so I went where the market was going. I went where the demand was. And if you are known for delivering high quality services, your customers are going to stick with you, even in the midst of the pandemic. And I think what's really come clear to me from talking with CDA candidates around the country, those folks who are offering high quality services, they are remaining stable. And that customer satisfaction is one of the elements that sustains their business during these difficult times. Got you.
That's powerful too. There's so many things that fall behind it. I've seen as well, just so you know, some love in the chat about the CDA. So you just had to point that out. But when it comes down to that, how does it tie back to, making sure, just because I'm a little unfamiliar with the full scope of CDA, but when it comes down to it, how does this, play back on professional, on educators now when they, we're such a dire need right now to make sure they're in the classrooms or they're working from home, whatever it is they're doing. How can CDA just make sure they're working with the centers correctly to help provide for them?
Well, we've noticed an uptick in the CDA. I was really amazed to learn that more people this year have renewed their CDA credential than the previous year, even in the midst of the pandemic. Yep. What we see is that early childhood professionals across the spectrum are sharpening their skills and retooling themselves for the future. Now, we anticipate, as the benchmark has said, we anticipate a downturn in the sector. Yep. But we are not seeing that necessarily in the acquisition of the CDA, that more people are interested in this credential. And it is perhaps because people are coming back to our field and they want to make sure that they have the credential needed to get right back into the sector. So we're hoping that means that for early childhood, we may not see the shortages that other education institutions are seeing, like in K-12 education. Okay. We're seeing an uptick in the renewal. So that means that we might be more prepared than other parts of our profession going forward. So we're hoping that is the case. But we always say at the council that the CDA is the best first step. So we know that there are many credentials that people hold in the field. I hold a bunch of them myself, but it is the CDA that really launched me into early childhood education and really prepared me for the work. So we're hoping that that's true going forward as well.
I hope so as well. And I'm glad to hear that you guys have seen that uptick, and I hope that it continues to go up because it's positive signs, that's for sure. So
absolutely.
We've known, from the benchmark, we saw that the outlook for the sector was down by 33% this year, which of course makes us all very nervous. But with that said, it's shown us how critical, of course, childcare is right now in supporting parents and getting parents back to work. Maybe any advice that you want to leave us with for providers to just keep the faith, or any words of wisdom that you want to leave us with?
Well, I certainly hope folks are keeping the faith, but I really am excited about what I'm seeing and hearing from the policy perspective. I think for the first time in my lifetime, childcare and the early care and education field is really on everybody's mind. Maybe for the first time, people are really figuring out how essential childcare workers are. I mean, in fact, they are my heroes. And if we have folks that are working in centers and family childcare homes, working with young children, you are my heroes. And what's more important is that the world is seeing you as heroes as well. And so we have to strike while the iron is hot. Really, let your policy workers, let your policy folks know, whether it's at a state and local level or whether it's at the top of government, let them know that you want them to come through for the early education sector, that you want them to make sure that early care and education is at the top of their minds. And so as they are preparing to do things for the economy, that they don't leave out what I guarantee you today is an essential worker. Those that are working with our youngest children, they are essential to any economic proposal that any government may put forward, because without them, people can't go back to work.
Yep. 100%, Calvin, 100%. I love that. Let's jump in. Stay with me here. We're going to jump into Q&A. I want to invite everyone to come back on with us, but I'm going to start with you, Calvin. Lisa wanted to know, and she's curious about how CDA actually started.
Oh, that's wonderful. That's a wonderful question.
Yeah.
The CDA is 45 years old, and it actually started in Head Start.
Okay.
The leaders of Head Start 45 years ago, really, they were looking for a way to not only provide competencies that those working with young children can really embrace and move forward with, but also add a layer of economic mobility for those parents who had children enrolled in Head Start. So the CDA really was birthed not only as a competency-driven tool to help professionals work with young children, but also as a career ladder for those parents who had children enrolled in Head Start. So we owe our beginnings to the Head Start program. And we've been celebrating, Carla, as one of your presenters, she helped us celebrate the 45th anniversary of the CDA. And so we're really proud of our history.
I love it. Before the restaurant, I want to make sure as well to thank you from everyone here at Hi Mama Calvin and everyone at the CDA for partnering with us for this year's 2020 benchmark. It's been an absolute pleasure having you guys with us and being able to have you as well on today. So thank you for joining us today as well and being a part of everything moving forward with the education space.
Absolutely.
All right, I've got a couple of key questions, and I want to invite Andy, Carla, Sydney to come back on so that this way we have a couple of questions, and we're going to kind of throw a couple of, I think, financial questions at you guys, just because we've had them. Obviously, we've all read the benchmark. I hope you guys did your homework. And maybe, Carla, I'll start with you. And I obviously as well, jump in, folks, if you guys want to jump in on any of the questions. But Carla, I'll start with you. Do you have any advice for centers who may be looking at getting into some funding or for their programs, or maybe where they can even start to look right now as the pandemic just continues to wind up?
Well, a couple of suggestions for some of the centers. We're very fortunate in Georgia. We have a very robust program that supports a lot of the different centers. So if you have not checked with your state to see what sort of programs are happening, then you should be. For example, in Georgia, they have the ongoing scholarships and incentives program, which provides teachers to be able to go back to school and funding for that if they don't qualify for the Pell Grant or the Hope Grant here in Georgia. But also during the pandemic, and I know we don't have much time, they put out a lot of programs to help centers be able to get their teachers to get their CDA. They provided programs to go back to school. They also provided programs for actual physical curriculum and different types of support and substitute type teacher programs. So Georgia has really just kind of led the charge, but other states are doing things as well. South Carolina's got some great programs, Texas, Virginia. So check with your state.
Definitely for us here in Canada, it's pretty much province by province. I know that as well. Does anyone else want to weigh in about looking for funding or even looking potentially for a program to help them with direction to funding or anything like that? The center's playing, guys.
Well, I am hearing that some philanthropists are really interested in supporting the childcare industry. I know the Kellogg Foundation issued a presser a few months ago saying that they were going to corral funders together to think about some ways in which they could support the childcare sector. And so those who are able to apply for foundation grants and other opportunities, and maybe not on the ground level, but certainly programs like those that are on your call today, we may be able to think about some creative ways to support the sector going forward using some of that foundation money.
Fantastic. Andy, I want to go back to you for a sec quick because I wanted to ask you a little bit more about your thoughts on this vaccine. And we all know it takes a while for a vaccine to come through, but what's your thoughts on it right now? Do you feel like this is too fast for a vaccine to be absolutely appropriate? Do you feel like they're doing the right steps? What's maybe just your overall thinking around it?
Yeah, I mean, I'm assured in the process. I feel confident in the process. I think we've seen a few trials that have had to stop because they've had some bad results. So I think that's reassuring to see. But ultimately, we're just going to have to go where the science leads us, and this is a really, really quick, rapid effort. So and the good thing is, I know there's been some comments in the chat and stuff. Doesn't matter what the outcome, whenever it's settled here in the United States, of the election is going to be. This stuff is proceeding forward, and I think you can be assured that this is going to be done outside of the sphere of politics. So no matter what the next few months hold, and it'll probably be some drama, the science will continue to guide this process, and they're going to make sure that the products that come to market are safe and hopefully very, very effective.
Andy, how soon do you think young children will be vaccinated? I know that was a question that I've been hearing from CDA candidates on our end.
Yeah, well, what's interesting about this particular virus is we know that the children aren't really, dying from it. So I think that they're going to be a little bit further down the priority list than you would see in a normal pandemic, because normally it's the very old and the very young that would be most at risk. So I would say you're probably not going to see a lot of efforts around vaccinating children until we can get really those adults that are most at risk, the immunocompromised, the folks with pre-existing conditions, all that kind of stuff done. So I would suspect you'd probably start to see some of that around June or July if I were to make an educated guess.
It's definitely a hot question, and I agree when we were chatting there, Andy, about hopefully frontline workers will go up the chain first, and those who are at high risk, and we all of course hope that. But I want to go over to Cindy, because I actually have a question for you. Your team is obviously working very closely with business owners right now. Maybe what's been a highlight from working with them during the pandemic? It can be big, it can be small, but maybe what was a big win or small win that you've seen over the course of the last several months?
Wow, that is a good question. I would say the reinvention and reimagining of businesses. The clients that we are working with are growth-minded and I don't know, just positive on their journey of, rather than letting this be a stumbling block for them and holding them back, they're like, what can we do to change? What can we do to reinvent ourselves? What services can we add? How can we support our families better? And so just that way of forcing, like this pandemic has forced our business owners to really look at those things. And it's so easy sometimes just to get caught up in the status quo and everything is floating along and you don't really see the need for change or innovation sometimes. And the programs that have been added and the connections, I mean, some programs were delivering, craft kits to their homes of the children that wouldn't attend, and adding the virtual preschool and finding new ways to, tell their story and connect with families has just been amazing. So we have been really, really inspired by all of that. And, actually sometimes taking some of their advice and applying it to our own business. Because, when you're in the midst of lots of, growth-minded business owners, no matter the business, you can usually find a little nugget or a tidbit that you can tweak to improve, your own business. So that has been really, really exciting.
It's so true. I think we've learned a lot from each other over this entire pandemic, every single one of us. One last question, and anyone who wants to jump on this, and then we will wrap up. But we've got a question here from Richard. Does anyone expect to see teachers' wages to increase in 2021? I want to say no. I'd hope so. Anyone want to weigh in?
Well, I almost might say yes.
Oh,
yeah, because I mean, it's not maybe a popular thought, but if you want to attract and retain teachers, which we do, and especially with the perceived, at least, health and safety risks, in order to get them to come on board, you might have to increase the wage a little bit, or do a signing bonus, or maybe promote some perks. And when I say like perks and benefits, it doesn't just have to be health insurance. There's lots of different super low cost things. It could be just as fun as your birthday is off, and that's a perk. You know what I mean?
Yes.
You might have to get a little bit more creative in what you're offering and present it in a way that's really, really attractive. I don't know, about the industry as a whole, and I know our margins are really, really low, but that is definitely a tactic that you might have to bite the bullet on for a while in order to attract more, because that's actually, well, as the benchmark survey said, that's one of the top two gains for owners is we need enrollment so we have the cash, and we need staff so we can provide our service. And it's been difficult for our members to find the newbies.
Well, and I'm going to piggyback on what you're saying too, because when the pandemic happened, and childcare workers were out of the field of working, when it suddenly those centers started to open back up, what happened is it wasn't just the fear of safety of going back, but they were also finding other jobs during that period that were paying that little bit more. And, $2 extra an hour is a lot of money for these people, for this industry here. And so, I would have said no, but you know what? I think that maybe we will see an increase, and they deserve it. So
I agree. Andy, Calvin, do you want to weigh in at all on that? I know it's, I kind of feel like the same thing. It might be something that sways. I said no originally, but might sway.
Yeah, I think we should keep hope alive, and I certainly want to advocate for higher pay for early childhood providers. I do think we need to fix the financing structure.
Agree.
Folks are paying more for childcare than they are. I was reflecting earlier, I pay more for childcare than I do my college tuition for my 19-year-old. So it really is an important thing to solve in this country and probably across the world. We've got to figure out how to sustain and support a financing structure that will pay people more, but also give relief to families who depend on childcare.
Mm-hmm. Agreed.
Yeah, and I think, maybe we'll see. I think this pandemic, as it's been noted before, has really exposed the value of childcare and how the countries, plural, come to a grinding halt without them. So here in the United States, we have a new administration. We have new members of Congress. We've had senators like Suzanne Collins. We've had senators like Elizabeth Warren who've been advocating for childcare. And I hope, I know Head Start is looking at potentially a pretty big increase in funding. I hope the rest of the early childhood education sector comes along for the ride on that, because certainly we've seen a lot of sacrifice from family providers and a lot of center-based providers as well. And I hope we can start to get to a place where our sector is going to be valued and the money is going to be equal, no matter if you work in a Head Start, a family child care, or a center-based care. That would be really something for 2021. So here's hoping, and let's see if we can get that done.
I agree. I want to thank each of you. I know I have been, as we've been sort of ending each of the personal sessions here, but thank you again from everyone here at Hi Mama for partnering with us on the 2020 benchmark. It's been an absolute pleasure, Carla, having you on, Andy, Cindy, Calvin. Absolute joy. This has been a fantastic session. You guys have gotten a lot of love in the chat, and it's been just phenomenal to have you. So please keep doing what you're doing, being the voice for educators now, making those big impacts you guys are doing. And once again, thank you for joining us. It's been amazing. We're going to jump into wrap up. So thank you and take care. And I hope 2021 is absolutely fantastic for everybody, and I wish all good health. But let's jump into some last shout outs. I want to give a big shout out to just every single educator out there right now, and who's working front lines, who's working from home, who is just doing whatever it is you're doing. I wanted to make sure to shout every one of you out. And I also want to thank everybody who took the time to fill out our benchmark survey. If you didn't get a chance, don't fret. I want to make sure that you can do it next year. So don't worry. It'll be there 2021. Watch for the next benchmark and the other parts that we want to cover in the files section. Please make sure you grab your certificate if you'd like to have it now. It's being shared there. Don't forget, just fill in your name. You download PDF, fill in your name, fill in your center name. It'll be good to go. If you didn't get a chance to get it now, don't fret. It'll be in the show notes. And I just want to make sure as well, Carmen's just reporting in case you guys are having some issues. We've had a report that there's been some cracks in the system, and we hope to amplify the voices of our educators, of course. And we need to move forward towards the change, folks. This is so much to our partners and everyone who came out today. Thank you all for spending the time with us. And we're working on the technical issues, and we will see you again. So if you're looking for your benchmark report, please hop on. Link is being shared, but hop on if you can't find it. It's himama.com/resources/benchmark. You can download it there. It is worth the download. It is worth the read, folks. It is powerful. Let me tell you, our largest one yet, 862 responses, and this is across North America, folks. So please download your copy. You also as well can get previous benchmarks if you do want to do a bit of comparison, okay? So if next week, if you're looking at joining us, we're talking a little bit more about building a positive mindset around your finances. This is a huge piece, so please be here. It's going to be a lot of fun, and I'm very excited to have our special guests on there as well. If you're not following us on social media, please do. Hi Mama app. Hi Mama app, Pinterest, HiMama.com. You can find us everywhere. But the big one here, Facebook, folks. Today, Miss Kaya has let me know we are doing the announcement of our contest winner. I will be with her live at 3:30, so really just a little shy over 15 minutes from now. But please be on there, and especially if you were joining us or did a submission, we're looking forward to seeing you there. It shouldn't be more than 10 minutes, folks. Okay, so join us on social, Hi Mama Facebook. Thank you to all of our benchmark partners for joining us, of course, as well as for everyone here joining us today. It's been fantastic. This has been an absolute pleasure on my end, of course, and I'm so excited to meet all these great people and be able to chat with them on a regular basis. So thank you for joining us. Stay healthy, stay happy, stay safe. Until next week, folks, we will see you then. Take care and stay safe out there, okay? All right. Bye, everybody. And no, as well, Carmen says bye. Don't forget. Say bye to Carmen. See you soon.